Hi guys. Woo. Did I mess up the camera? Let's try to fix it. Welcome to my channel. Welcome. This is Charlene Sonia Nanch. Today I would like to talk about the valves of the heart. Like I mentioned previously, I just made a video about electrical conduction, electrical activity in the heart. Yeah, so I think I'll make a video with the meds, like for the dysrhythmias and stuff like that. Yeah, so basically from the previous video we mentioned that things could go wrong within your heart itself. Like maybe months ago we talked about, like, you know, coronary arteries, like the arteries that like kind of feed your heart. We talked about lack of oxygen to your heart due to the blockage of the arteries. But now we're talking just about like actually stuff happening with the structures of the heart. And I mean, we kind of need to know like those to kind of like help us with this too, because okay, let's get back on top. I feel like I'm going off tangent really, but like we mentioned earlier, there could be a problem with the valves, there could be a problem with the electrical activity in the heart, or there could be a problem with the chambers, and you know, one could cause the other. Like for example, I'm going to talk about stenosis of the aorta, which could lead to dilation of one of the ventricles. Okay, so now we're talking about the valves of the heart. Okay, we can talk about the whole anatomy of the heart, but for this specific video, it's just important to just know that your heart has multiple valves. It has the tricuspid valves on the right side of the heart, which separates the atrium from the ventricle. It has the mitral valves, or the tricusp valves, which separates the atrium from the ventricles. Then we've got the aortic valve, which are the semilunar valves, which bring blood to the body, and we've got the pulmonary valve, which sends blood to the pulmonary or to the lungs to be kind of like, you know, for exchange of oxygen to blood to happen, for it to send it back to the heart. So basically I just told you guys like the valves of the heart. What is the function of the valves? Like, you know, the valves just kind of like help open or close, you know, the chambers. Let's say like the ventricle is filling, it will, you know, it will be open so the blood can go in, or close when it needs to go to like another, you know, to the pulmonary, you know. So it just helps to like for efficient normal blood flow in the heart. Okay, so what could go wrong with the valves? We have the aortic valve, right? The aortic valve is I think I want to start with the mitral valve, and we'll focus only on the mitral valve and the aortic valve really, because that's where the left side of the heart is what usually pumps blood to the body, and that's where most of the problems happen. So the mitral valve on the left side of the body, you know, it could regurgitate, it could prolapse, or it could be stenosed. Regurgitate means, well, prolapse first of all just means that the valves kind of just like pushes out into the so let's say like this is your heart, the valves are like this, and it's like connected to like these tendons, and yeah, and it has like leaflets, so it's like this, but when it prolapses it kind of goes in. So when it goes in, like instead of blood coming in from the atrium, it kind of push, like, you know, it goes back like this, and it causes a sound called a mitral click. It's mostly seen in women. It could also be genetics. It's not a cause to worry. Most other times it is symptomatic, like it doesn't have any symptoms, so usually we don't really like do anything to it. But if but it could be symptomatic and have signs and symptoms of like a little bit of like heart failure, like difficulty breathing, cough, and all that type of stuff. But it's not like a big you know, big deal. What else about it, about prolapse? Yeah, like I said, it could be due to like enlargement or of the leaflets, let's say, like, and then it just prolapses, or it could be due to like an enlargement of the valves themselves, which causes them to like prolapse. Okay, So yeah, so we'll treat this prolapse with a valvuloplasty, but we'll find out about it with a Doppler echocardiogram, looking at the structures of the heart. The other thing is mitral regurgitation. Again, we're still talking about that valve that separates the left atrium from the left ventricle. As I mentioned, like the valve can like prolapse, and it could, when it prolapses, it can keep it a little bit open, and when that happens, like all the blood coming, would just backflow. It's kind of like, okay, you're swimming, and then all of a sudden, like there's this current that goes up, and then all of a sudden, like, instead of going like this, it kind of backs up the way it's not supposed to go. And when that happens, is blood will back up into the lungs and cause signs and symptoms of heart failure. Patients usually are symptomatic with this, and they will have a high pitched systolic murmur. Like, when you listen to the heart, it will have a harsh pitched systolic murmur. We can check it out and make sure to diagnose it with like chest x-ray, a transopharyngeal echocardiogram to look at the structures. What else could they do? And it's usually due to actual rupture of like those papillary muscles that hold the leaflets and the valves together. I guess that's why we really need to know our anatomy. Like, oh my god. So yeah, that happens. It goes boom, backs up, and it causes signs and symptoms of like heart failure, like trouble breathing, paroxysmal, pain while breathing out, and like pain while difficulty breathing while laying down. You have to kind of like stay up to breathe. Cough, chest pain. If the regurgitation is so bad into the lungs, it can actually even cause like hemoptysis. But we'll save that for one second, guys. We'll save that for stenosis. So there could be now another problem with the valve, the mitral valve still. It could be stenosed, meaning that it becomes like the valve becomes like hardened, like it becomes hard. Usually, from what I remember, it's like if you're eating fatty type of food, so the valve, or there's like some sort of infection, like from endocarditis or something like that, the valves kind of inflammation happens, and then it fuses the valves. So when it fuses like this, instead of having like this amount of leaves opening and closing, it's like this, and less blood is able to come into the ventricle. So then when that happens, then like there's accumulation of blood in the left atrium, and with that it can lead to pooling of blood, which could lead to dysrhythmias. I'm guessing one of them could be like atrial fibrillation, or A-flutter, one of them, like an atrial dysrhythmia, like one of the ones that we talked about earlier. And what that happens is very, very dangerous. It will just pull, because it's not even coming into the ventricle. It will pull and back into the lungs, then back up into the pulmonary, I think, is it the artery, into pulmonary artery, into the right ventricle, where it will cause right ventricular hypertrophy, like on the opposite side of the heart. So I feel like with all of this, the one that is the most dangerous is mitral stenosis. So then the other thing that could go wrong is with the aortic valve, like the valve that connects the left ventricle to the aorta, like the pumping of blood to like the body. If that happens, you can already see if that is not working, then we're not getting cardiac output, like the body is not getting oxygen. So with that, blood can come from the rest of the heart, and it will just be pulling in the left ventricle, and this will cause dilation of the ventricle and eventually hypertrophy of the ventricle. And the other one is hardening. I forgot the name. And with hypertrophy, we'll need a heart transplant. I'll talk about that in the next video. In general, most aortic valves are asymptomatic. Like aortic valve problems are asymptomatic, but it's still the same signs and symptoms of heart failure. Yeah, with regurgitation, stenosis with aortic is still the same thing due to fat, infection, sedentary lifestyle, regurgitation, like same type of thing. It's just, excuse me, I don't have a reason why, but it regurgitates. And we can fix this. Okay, so in general, excuse me, with all of these conditions, we can fix it with something called a valvuloplasty. Basically, they fix the valve. They don't replace it, but they fix it. So they can do like a mechanical that is a valve replacement. They can do a commissurotomy, which is like usually for stenosis. They can do a balloon valvuloplasty, where they put a balloon between the right atrium into the left atrium into the mitral valve. So, and then they'll use, if it's open surgery, they'll use a bypass, which is using an external force, an external machine to like kind of remove the oxygen, like kind of like, you know how your heart brings deoxygenated blood, so that's what it's going to do, cool it, put oxygenated and do the job of the heart. Yeah, so with that, they can do a chordoplasty, where they fix those cords that kind of came out for it to cause regurgitation. They can do a valvuloplasty, a leaflet replacement, where they kind of cut it off or whatever if it has just been hanging. And they can do an annuloplasty, where it will just cause tension and decrease regurgitation in the heart. They can also do mechanical valve replacement if the valve is just not good enough. There are two types of valve replacement. There's mechanical valve replacement and there's tissue valve replacement. Mechanical valve replacement is good for young children, healthy, because it's less chance of infection, but then the patient has to be on anticoagulants for the rest of their lives. So this wouldn't be good for like a pregnant woman or a woman who plans to be pregnant, and older adults, because they're already frail, risks for infection, risks of bleeding. So, or a young child, it wouldn't be good for them. I think that is it for the video. Oh yeah, so the other thing I was going to talk about is like with all of these things that's happening to the structures of the heart, most of these problems kind of like are caused by infection, which will be infective endocarditis, but the valves itself can also cause infective endocarditis, because if you think about when you usually with these valve stuff, you're putting foreign stuff, you're putting foreign tissues in the body, so you might be on a corticosteroids or whatever, but this is also a high chance for you to get infections. So let's talk about like so if you put this on, you are at risk of bacterial endocarditis or infective endocarditis. You're at risk of it. Like it's like you're either at risk of it when you put in the valves, or the infection caused either the regurgitation, the prolapse, like the infection kind of like messes up with the leaflets or the annulus or whatever, or causes it to fuse together. So risk factors for this, I already talked about it, like valve replacement, hemodialysis. What other stuff can cause it, like using needles, tattooing yourself. So then they'll treat this with penicillin, and usually prophylactic, like if you've had a valve replacement before any sort of GU, GI, or going to the dentist, you're gonna have to take antibacterial to kind of like as prophylaxis, or to stop the person going, or to stop yourself from getting these infections. But if you have this bacterial endocarditis, the signs and symptoms you want to look out for are usually it comes with fever too, but you have the rut is a rod spots, which is like red spots in the eyes. Janeway lesions, those are like the painful hands, I'm trying to think of it outside instead of looking at my notes. Janeway lesions, the rod spots, the Osler's nodes, which is still the same thing but it's not painful, splinter hemorrhages, all of those stuff. And yes, I think that is it. I don't know, but I feel like, oh yeah, we're good. The video is good. Okay. Thank you for watching my video. These ones are kind of like very complicated. On the next video I'll talk about the ventricles of the heart, the chambers, you know, what could go wrong with the ventricles. We kind of talked about it here, but we're gonna go further into it and how you're gonna treat it and things like that. Thanks for watching my video. Bye. Peace.